Well, good morning, everyone. I know we're going to kind of steady have more people joining us. We've got 17 right now, which is nice. I see a few familiar names that have come up a few times, so that's also nice. Welcome. So we'll go ahead and get started. Jessica's going to kind of steady let people in from the waiting room as they arrive. So everyone that's joining us right now, thank you so much for joining us. My name is Candace Christensen. I'm the coordinator for the Caregiver Coalition of Northeast Florida. We started these virtual workshops as a response to COVID-19 so that we could bring caregivers here on the First Coast updated resources and information and support from caregiving experts. So we're so glad you could join us for this morning's session on preparing for a crisis during a crisis. A lot of things have changed in such a short time because of COVID-19. I mean, leaving the house is different, is a different experience. Going to the grocery store is a different experience. Seeing a doctor is a different experience. And caregiving is a much different experience. We have to take a lot more precautions to keep our loved ones safe. So preparing for a hurricane is going to be a different experience this year, and we have two fantastic experts joining us to share updated emergency preparedness information. So joining us, we have Eric Anderson. He's the Emergency Preparedness Manager with the Northeast Florida Regional Council. Eric is a designated Florida Professional Emergency Manager through the Florida Emergency Preparedness Association. He's a certified planner through the American Institute of Certified Planners and a master exercise practitioner through the Emergency Management Institute. So thank you, Eric, for joining us.
Oh, thank you for having me.
And we also have Jason Miller. He's the Disaster Preparedness Planner with the Florida Department of Health in Nassau County. He has an extensive background in operations and government operations, holds an associate's in emergency administration and management, and a bachelor's in public safety management. Jason received recognition from the National Association of County and City Health Officials for his implementation of the Stop the Bleed public health program in Nassau County. So thanks for joining us, Jason.
Good morning.
So really quickly, I would like to go over some housekeeping items. First of which is the session is being recorded and it's going to be posted to our website. So all cameras and microphones, except for those of our speakers, have been turned off, and we ask you remain muted until we reach the Q&A session towards the end. If you haven't already, you may want to turn on speaker view in the top right corner of your Zoom screen so that you can better see the speakers. If you find yourself with any questions during the first half of the workshop, please type them into the chat box and I'll make sure that they get answered at the end when we get into the Q&A session. And then once we get in the Q&A session, you can use the chat box and we'll kind of continuously answer those questions until we reach the end of our time. At the end of the session, we're going to be holding a short poll on what you liked and didn't like about the session so we can continue to improve them as the months go on. Everyone who fills out the survey will be eligible to win a $50 Amazon gift card, and we will reach out to the winner by email after the session. And lastly, in the case that we run into some technical difficulties, please be patient while we try to resolve them as quickly as possible. So without further ado, let's go ahead and get started. Eric is going to start us out with an overview of what we can expect this hurricane season and what we can do to prepare. Take it away, Eric.
That's right. So, good morning. My name is Eric Anderson. I'm the Emergency Preparedness Manager at the Northeast Florida Regional Council of Governments. We represent 7 counties and 26 municipalities across Northeast Florida. And if you're in the 4 coastal counties of Nassau, Duval, St. John's, or Flagler, or 3 interior counties of Baker, Clay, or Putnam counties, then you're under the umbrella of the Regional Council. We appreciate the opportunity to speak today on the upcoming 2020 hurricane season and provide some general guidance that the state has provided. You'll hear me and Jason both today always say, refer back to your local emergency management office at the county level, because the things that we're talking today are general in nature, and your counties have developed plans based off these guidance that are specific to their counties and resources. So we encourage you to please reach out to your local counties and their emergency management offices and their websites for local and specific information on hurricane preparedness activities and guidance if we actually happen to get a hurricane. Secondly, there's also notification systems within each county. If you're in Baker County, they have the Baker County Alert alert system. If you're in Duval County, they have the JAX Ready app for your phone. So there are multiple different notification services that I recommend that you sign up for this year if you haven't already done so, so that you can be getting the most specific and up-to-date information from your local emergency management office on information and expectations. With that being said, if you'd please advance to the next slide. Yep, and to the next one, please. So today's presentation and topics, we're going to cover 5 different areas. And the first component of this, we're going to talk about the early season forecast. You know, why is the meteorology lining up the way it is, and what do we expect from this year's storm season? We're going to talk about the state's program called Know Your Zone, Know Your Home, which will be launched this year as part of information for you in preparedness activities. We're going to talk disaster supply kits and additional components to have with you associated to COVID-19, because there's added complexity with this year's hurricane season with COVID as a backdrop. And we'll also talk some general assumptions for evacuation and sheltering. Again, I will always point you back to your local county for evacuation specific information and guidance. That's very important. And everything that we're talking about today and the links that have been provided within this presentation are also on the Florida guidance under floridadisaster.org, the /prepare or plan prepare. All the things we're talking about today and additional links within this presentation will have guidance there related to the topics that we'll discuss today. So Candace, if you'd be willing to move to the next slide, please. So the 2020 Atlantic hurricane season. As you can see, the National Oceanographic and Atmospheric Administration have come out and said, and really many of the other leading scientists and weather organizations have come out and said, we believe we're going to have an above average season. It seems that the climate, the oceans are all kind of in perfect alignment this year for us to have a busy season. You can see in the box on the right-hand side, in a typical year, we average 12 named storms, 6 hurricanes, and 3 major hurricanes. And being that they're predicting an above average year, you can see that those ranges are above those typical averages. So named storms 13 to 19, the hurricanes 6 to 10, and major hurricanes 3 to 6. And in reality, what we're also talking about is based off the climate conditions and kind of where we're at already in this season, we may be towards the higher end of these ranges in terms of productivity within the basin for hurricanes. Now, that does not mean Florida is going to be hit with multiple hurricanes. Please hear me loud and clear. All this means is that we may have additional hurricanes within the Atlantic basin. Some of these may go off in what we call fish storms and go out to sea, but this does not mean that Florida is being hit by a hurricane. It just means that we need to be more prepared than in typical years because the propensity for storms in the basin are higher. So next slide, please. We've already had a record-breaking year. We're in mid-July right now. We've already had 6 named storms. A couple of these record setters in terms of their endurance or where they've been positioned. We're in mid-July right now, and we're already going on a G storm. So as the meteorologists had talked about us having an above active hurricane season, we've had a very active early hurricane season. Really hurricane season's heart doesn't really start, we don't start getting into the heart of hurricane season until really that mid-August, mid-September is peak. And then we kind of tail off into October, still pretty strong. So at least based off of what we've seen so far, we've had a higher number of average sets of storms. With that being said, it looks like we're in line with kind of the data and the assumptions that the experts have predicted for our meteorology. If you'd be willing to go to the next slide, please. So with that being said, the state is really going to be pushing a new concept this year called Know Your Zone and Know Your Home. So 2 different sides of this. Know your zone. Number 1, do you know your evacuation zone? Secondly, are you also maybe potentially in a low-lying area or an area that floods regularly? Are you in an unsafe structure or mobile home? Those are all things to consider in Know Your Zone. But the biggest portion of that is Know Your Evacuation Zone. The other component of this is to know your home. If an evacuation order is made, but you aren't in an evacuation zone, then they will be encouraging you to likely hunker down in your current home. So there's some strategies and things that we'll talk about here shortly on knowing your home and making sure that it's able to withstand a potential storm. So please advance to the next slide. So the first part of this, do you know your zone? I think most people who have lived in Florida understand that, have gone through evacuations, particularly in the last 4 years in the state of Florida, between Matthew, Irma, Michael in the Panhandle, and even Dorian this year. I think people are kind of well-versed in hearing the information, and I really encourage you to please understand and know your evacuation zone for this year, because it's going to be You need to have an understanding of how you implement your plan and what are triggers to implementing your plan if you need to evacuate, and having an understanding of the evacuation zone that you're in and what your local county's information is being provided to you about your evacuation zone is critically important. At floridadisaster.org, at the link there on the site, you have an opportunity to click on your county, and you can also go see what evacuation zone you're in. And likewise, within your typical county emergency management pages, websites, they'll also have guidance on your evacuation zones. Now, it's important to note here in Northeast Florida, we're not only susceptible to A, B evacuation zones along the coast, but we all have intracoastal waterways, and we also have the St. Johns River. So even inland counties like Clay County and Putnam County, which were impacted both in Matthew and Irma, may have evacuation zones along the river as well. So it's important to know that even if you're inland, away from the coast, you still may be in an evacuation zone or susceptible to surge from a storm. So it's important to know that. I highly encourage you, if you don't know your zone or if you haven't ever looked it up, to do it now. It's like the baseline information you need to be able to develop a plan for you to be prepared. And that's all I have on zones. If you go to the next slide, we'll talk about the home side of it. So the other component of this is, if you're going to choose to stay at your house, does your house have the ability to withstand a potential storm? And the guidance that the state has pushed out this year has said that most homes built after 2002 are more resilient to hurricanes. And that's just due to, construction of your house, new materials used, hurricane straps, other things that help to mitigate and protect your house and you and your house for a storm. So that's a big important component that we'll talk about today. I think what's a big component of this today is I'm really asking for people to become prepared and to do this on their own, because you are in control of your preparedness actions, and for you to be ready to implement your plan when called upon or if a storm gets here. If you're just starting to make your plan or just starting to prepare your home upon the storm arrival, then you're already late. So you'll see me hammer this home a few times on being self-prepared, and I'm going to try and provide you some guidance on how to best self-prepare yourself in advance of a hurricane coming to this area. So if you go to the next slide, please. So one really good resource as we talk about not only emergency plan building, but also on how to best protect your home and things that you can do to your home to make it more resilient. There is a national website called #HurricaneStrong. And it's a program that offers collaboration, but it's really about empowering local citizens to be prepared. And you can see on this right-hand side that we have all of these different categories: sandbags, strengthen your gutters, flooding, insurance checkup. When you go to this website, if you click on any one of those folders, it's going to take you to a wealth of information specifically about that topic. So if you have flooding concerns, home inventory, landscape design, evacuation zones, any of those types of things that you're interested in and that may be able to help harden your house, make you more resilient through a storm, these are all the resources that are available to you, and they're very easy to navigate, and really you have the ability to select those things that are important to you instead of just getting everything that you would typically get with a package. So it's a very useful resource, and they're also educational materials for kids if you have families or grandchildren, to help them also help you along with these preparedness things. Next slide, please. All right, so this is your typical disaster supply kit. I think most people have seen some variation of this type of supply kit, in every hurricane related presentation. But this year's a little bit different with COVID-19. We've added an additional section, or the state has added an additional section to accommodate for the CDC guidance. So additional items in the kits to prevent the spread of COVID or any other virus or flu. But it's really important to note: face masks, disinfectant wipes, hand sanitizer, any of those personal protective equipment items that you need is important to include with that disaster supply kit. The other component of this is that in most years, we typically tell people have supplies up to 96 hours. I would encourage you that 96 hours is really a baseline. I would encourage you to try and stretch to see if you can get to 7 days of having stuff on site. I would always rather have more things that I can dig into than be caught without the necessary things if I happen and need to ride out a storm. So take these considerations. If you already have a disaster supply kit, please include and add some of those additional considerations for COVID-19 supplies. If you've never done a disaster supply kit, this is an easy way for you to just start checking the box for items that you need to collect around your house and locate in a specific area that you can access easily. So that's, as you can see, it really covers pet items, first aid items, important documents, which is a really big one, food and water, obviously, and then the critical components related to COVID-19 supplies this year. So feel free to use this checklist. This is also the checklist that's provided on the floridadisaster.org website regarding your disaster supply kit checklist. So we also talk about this, we're doing this for hurricanes, but this disaster supply kit is really a universal supply kit that can be used for any type of event, whether it's wildfires, flooding, storms, anything here in Northeast Florida. So it really is just a good tool to have and be prepared for any type of event. But particularly in a year where we have an above average hurricane season with a COVID-19 backdrop. So next slide, please. So let's talk a little bit about assumptions for this year. So again, I'm going to use some soft language. You're going to hear me say may quite a bit instead of will. I'm really trying to provide some assumptions of what we believe are expected to happen. So really since March, a vast majority or a lot of our hotels and motels have reduced operations. We don't have 100% occupancy in places, and as such, we may not statewide have a lot of hotel rooms and motel rooms that we've had in the past. It may be fairly restricted. I don't want to scare anybody, but I mean, it's pretty obvious if you just look at the cards that you know, the hotel industry is taking a hit by COVID, and as such, they're not ramped up to 100% to be able to meet capacity. So that's one component of concern. Evacuation timeline may be extended and a little bit of additional time to be able to accommodate for people to find the right shelter and the places that they need to go with the COVID-19 backdrop. Now, again, that's statewide guidance saying that it may be expanded for consideration. Again, it'll be very important for you to listen to your local elected officials and your planners from your county on what evacuations will look like, timing, expectations, zones that will evacuate, and other guidance. And then, and I know Jason will touch on this in a little while, but sheltering operations are going to be a little bit different in each county this year, just due to the social distancing requirements due to COVID-19. So what you'll likely see in terms of posturing and messaging is, number one, they will encourage people to evacuate to a safe shelter that is close to their home. We don't need people traveling hundreds of miles to find evacuation sheltering. We need people traveling tens of miles for evacuation sheltering. Now, with that being said, we are likely to encourage people to shelter at home or with relatives and friends. Those are trusted people in your life. Many times those people are also social distancing or adhering to those protocols, but at least based off of guidance from the state this year, the first push will be to ask you to please go to a friend, family, or safe shelter. And then secondly, they really want to encourage our typical shelters that we've used in the past as a last resort. And that's always the language we've used, a shelter of last resort. But with that being said, you know, I think Jason will touch on the topics and expectations this year for sheltering and special needs sheltering, general population sheltering, but the state has provided guidance. Each county is going to have a different plan on how they implement that guidance based off of the resources, hotel stock, sheltering, staffing that they have. So it's critically important this year that you note that the county you live in and are getting the accurate information and expectations from the county that you live in. So with that being said, I think I maybe have one more slide associated with this. If you want to move to the next one, please. So sheltering considerations, and I know Jason's going to touch on this shortly, but check with your county for specific guidance on general population sheltering, special needs sheltering, pet-friendly sheltering. And there's also a website where you can access information from the state on each county's website or each county's shelter plan. But again, you can also reference your local county's emergency operations center to talk about or to look up information about sheltering expectations. There will be this concept of what's called congregate or non-congregate shelters. Jason may touch on that here within his presentation about the options that are available to counties for sheltering this year. But just know that all of those will comply with the ADA and Florida accessibility codes. And another thing to note is, you know, the state guidance this year says all individuals seeking shelter will be subject to infection prevention and control measures, including physical and social distancing, usage of personal protective equipment, screening, and isolation protocols. So these are kind of new things that get added with COVID-19 and sheltering folks. So I just want you to have an understanding of this may be a little different this year. It's very important that you reach out to your local emergency management program and collect the accurate information and how that will be implemented in your county. So that's kind of the end of my spiel. But again, what I really want to convey to you is in many years, you may have a plan for what you want to do. This year, I would encourage you to have a plan A and a plan B. Number one, COVID-19 is an evolving epidemic as we see. Number two, every storm is absolutely different. Matthew is different than Irma, that was different than Michael. So the complexities of adding a hurricane or potential tropical event on top of the complexities of COVID-19, I think are causing consternation and stress among people. So your ability to start planning now will make you more successful in the future. So please go educate yourself about your surroundings. Are you in an evacuation zone? If you're not, then what are the things that you can do to prepare your house and be ready to hunker down if a storm does come? And number three, do you have a plan if you choose to leave your house, and what does that look like? Does that mean you're going to family and friends, or does that mean you're going to a hotel, or are you relying on going to a last need resort shelter? So I encourage you to start planning now. We're already in mid-July and I've had 6 storms. I'm not telling you we're gonna have one, but I encourage you to have a plan in place that if you do, you're prepared to go, and the stress will be reduced significantly because you'll be able to focus on other things than trying to get prepared. So with that, I'll stand by for questions at the end. And again, I appreciate you giving me the opportunity to speak with you today on the guidance from the state. And again, reach out to your local county partners for further guidance. Thank you.
Thank you, Eric. So I just want to remind everyone that we're going to be sending a PDF copy of this PowerPoint presentation along with any additional resources after the session. So if there's anything you missed, if you wanted to write something down that you didn't get a chance to, don't worry, we've got you covered. We're going to send it to you after the presentation. So I'll go ahead and hand the virtual mic over to Jason, and he's going to tell us about the special needs shelters and registry.
All right, good morning. So we've all listened to what Eric said, and we're going to follow everything. So we're going to find family members in other areas, and we're going to try to evacuate there. If all that falls through, I don't want you to worry. We have a shelter for you. Every county right now has a sheltering plan for general population and special needs. So this will be the 2020 Special Needs Sheltering Plan. Myself, Jason Miller, I am the Disaster Preparedness Planner for Nassau County. So some strategies that we have for this year. The state basically gave us a mandate that, we will plan for shelters with COVID. It's a very ongoing and evolving situation right now. So what we've done is we generally try to put in place some very generalized strategies that could help us. What you're looking at are the basic, most fundamental strategies that we have right now in combating COVID. Entrance and continual screening. So what that means is basically we're just going to keep screening. Social distancing, mask and PPE use, more infection control teams, shelter exposure shelters, and a new special needs registry that we'll touch on. Those are our basic strategies, 6 commonly used and proven strategies. Next slide, please. Now, the first one that we're going to kind of touch on is the entrance and continual screening. So what we're going to do is when you come to a shelter, whether it's special needs or general population, you're going to have an initial screening conducted. That initial screening call is going to be when we reach out to you, when we pull down the registry, it's going to be a call that says, hey, we have a storm in the area. Are you planning to evacuate, or are you planning to come to a shelter? If you say you're planning on coming to a shelter, great. We're going to ask you a few questions to kind of basically assess your risk of have you had exposure to anybody that's a known positive to COVID? Have you traveled outside of the region? Have you been socially isolating? Once you've been cleared, we're going to tell you which shelter to go to, whether you go to a COVID-19 exposure shelter or a regular general population shelter or a special needs shelter. Once you arrive at the shelter, we'll do an entrance screening. Now, what that's going to do is we're going to check your temperature. It's not invasive. We're going to give you the oral temperature. We're actually going to do IR, no touch temperature screening. And that's going to be basically as soon as you get off the bus, you're going to be screened. If you start showing signs and symptoms at screening, we're going to go ahead and send you to the other shelter. We're not going to kick you out. You're not going to be rejected from all shelters. We're actually going to send you to a special shelter that can actually deal with any kind of issues or needs that may arise. Continual screening. So that's just going to basically be routine screening conducted regularly throughout the day. We're going to come by every 6 to 8 hours and just ask you, how are you feeling? Now, what we're going to do is we're going to call it passive monitoring. That's going to be where we're just going to ask you, hey, how are you feeling today? People are going to go, oh, I feel fine. We're also going to kind of monitor you. Hey, is this person experiencing any kind of symptoms, nausea, vomiting, diarrhea, loss of sense or smell, loss of sense of taste or smell, any of the classic signs associated with COVID, along with temperature screening. And it's just basically follow-ups every few hours. So next slide, please. Social distancing. If you've turned on the TV or watched any kind of radio or listened to any kind of radio in the past few 6 months, the one thing that we've pushed out is social distancing. Last year, shelterees had about 60 to 100 square feet per person, and there was no limit on the amount of family members that caregivers could accompany for the shelteree. This year, our special needs shelterees will get about 80 to 120 square feet. And what we're going to do is we're going to end up limiting you to one caregiver per patient. Where we have allowed the whole family to accompany the caregiver, and sometimes we've had 6 or 7 members of the same household accompany that person. What we're going to end up doing is, if the family members have been exposed, the whole family unit will go to a COVID exposure shelter. However, if everything checks out and everybody passes screening, we will allow the special needs shelter patient along with the special needs shelter caregiver, one per. So if you have 2 people that are special needs shelter enrollees, we'll have 2 caregivers for them. However, any other additional family members will have to go to a general population shelter, which is adjacent to our facility. It's less than a quarter mile away. So that we're not separating you from your family. We're just saying, hey, you can only bring a limited number in. And that is really to enable us to give the 80 to 120 square feet per person. Next slide, please. PPE use. Cloth and fabric face masks will be encouraged while in the special needs shelter. Now we understand people are on oxygen. We're not telling you to take off your oxygen and only use a cloth mask. If a shelteree is unable to wear a cloth mask due to breathing oxygen, additional distancing and face shields will be encouraged and provided. We have enough PPE to make sure that everybody is protected. We have cloth face masks, we have surgical masks. Staff will also be using isolation gowns and practicing enhanced infection control measures. So what you're looking at is there's going to be a lot of sanitizer, as pretty much you've seen everywhere. Most buildings now have sanitizer as you come in and leave. It's at the grocery stores. It's the new norm. It's going to be the new norm for quite a while. And we're really, most of the counties that we're in right now have face mask ordinance. I know Duval does, Nassau does. If you're in a building and unable to social distance, you're now required to wear a mask. That's not being said that, hey, if you don't have an underlying medical condition, you do not have to wear one. However, if you're able to, we definitely want to make sure that you're wearing a mask. Next slide, please. More infection control teams. Normally what we have is one member of our staff who's an epidemiologist that is pretty much responsible for what we'll call infection control at shelters. She'll do an infection control tour to make sure that everything's positioned correctly and people are actually taking, do they have soap in the bathrooms? Are people washing their hands? Are they using PPE? So what we're looking at now is actually making a team, infection control team. And these will be actually fielded from the Region 3, which, as Eric touched on earlier, combines a large plethora of Northeast Florida. We stretch from Nassau County all the way out to Gilchrist-Levy County on the Gulf Coast, and then down to I believe Flagler County, and Marion County is even included. And what we're doing is we have an actual incident management team, and they're going to provide us with infection control teams that'll be able to rotate around and assist with any kind of issues that we may have. We're also going to maintain our initial in-house positions. However, they're going to be more robust. We're also trying to train some of the school personnel who assist in general population sheltering with enhanced infection control measures and providing them with a toolkit to allow them to help out. Next slide, please. Exposure sheltering. In the event that you have COVID-19, you failed the enhanced screening procedures, which is the temperature or the risk questionnaires, or you have been exposed to somebody. You're currently in isolation due to potential COVID-19 exposure with a positive case, or beginning to show symptoms. What we're going to do is we're going to actually have what we're calling the exposure shelter, and that's going to be a special shelter that we are providing for people in these categories. Your cots are going to be about 10 feet apart, and movement will be restricted to only necessary activities. We're not saying that you can't come and go. We're not going to lock you in. However, we're just going to limit the amount of movement that you have. So instead of getting up and wandering around the shelter, if you would like to take a walk, we're going to ask you to walk outside. Now, this is a hurricane shelter, so in the event that we are experiencing tropical storm force weather or other inclement weather, we might not ask you to do that. However, one of the shelter that we have identified for this currently is it does have a large breezeway, so you can actually walk around underneath the breezeway and still be protected from most inclement weather except for strong winds. Next slide, please. So one of the new things that's been put into place this year is we have a new special needs registry. Special needs. A lot of people get kind of confused about that one. Special needs are medical oxygen or electrically dependent people. So if you need oxygen or you have a item that you plug in that's a life safety device that needs electricity, you can get on Special Needs Registry. Special Needs Registry is pretty much a system that the state of Florida put into place to allow us to reach out to these individuals. And you'll actually see the link on your screen. When they send out the PowerPoint, you can click on the link and it'll actually send you to the new Special Needs Registry. A lot of the new features this year allow us to do our job better and more efficiently. Where in the past it's been kind of not really a struggle, but more the system hasn't been very responsive. It's a great system, but it wasn't quite as robust as the new system. The new system's taken our feedback from the last 4 to 5 years of storms, because we've learned a lot during Dorian. We learned a lot during Irma. We learned a lot during Matthew, and along with Michael out in the Panhandle. So where Florida went relatively 10 years with no hurricanes, we developed the procedures the best we could. With the feedback that we've experienced and learned through the knowledge that we've obtained through actual response to storms, we've allowed for production of a better system. So it's much more user-friendly too. Next slide, please. This is actually what you'll see. Once you click on that link, you'll actually come to the Florida Special Needs Registry. This is the first page you'll see, and it'll say, "Welcome to Florida Special Needs Registry." So if you see a different thing, if you see any kind of a different screen or anything like that, it's probably not our screen. Now, once you've actually set your account up, you'll be able to log in through your email and password. I encourage you to write down your email and password. Most people say don't ever write down your email and password. I find that it's actually a little bit easier to go ahead and do your email and password with this one, but put it in a safe place. If you don't have one, you can always click on forgot your password. When you set up an account, you just go to don't have an account. So you just select the county where you want to live. Where do you live at? Not where do you want to go shelter at, but where do you actually live? Because we use this for multiple events. It's not just a hurricane registry, as a lot of people thought. It's more of a disaster registry. So in the event that we have a wildfire in Nassau County, I can pull down the registry and find out how many enrolled individuals or registrants that I have in a certain area. Something that affects the western side of the county may not affect the eastern side of the county. Again, it's based on what we need it for that crisis. Next slide, please. And this is basically what we're going to ask you for. your first name, your last name, your email, and your county. Once you hit a create account, you will have an account. Now, once that happens, you'll be asked for a lot of information. You may not have that information on hand at the current time. However, you can actually print out the sheet. You can have your caregiver, a family member help you with it, or your doctor. Some of the things you may not know. So once you have that enrollment form in hand, have somebody help you fill it out. You can submit it in paper, or you can submit it back on the website. One of the things that we found out was that some people that were a little bit older weren't quite tech savvy. They weren't able to use the older system. The newer system is really made for to be more functional for all age brackets. So that's pretty much your new special needs registry and how to enroll in it. Next slide, please. There's my information. That is my actual direct desk number. So if you call that number, you'll talk directly to me at my desk. I'm not guaranteeing that I'll be at my desk. COVID-19, I move around a lot. However, Nassau County Emergency Management, I also listed their number. They can help you enroll in special needs if you need, and there's always somebody at that number 24 hours a day, 7 days a week. And I believe the slides the whole packets can send out, so you'll have all this information. Also, I included a trifold that tells you what to expect when you're going to a special needs shelter and how to enroll, and information that's always good to have in a special needs shelter, with a link on the bottom for how to enroll, along with the link directly to the new special needs shelter registry. And then I'll stand by for questions along with Eric at the end.
All right, thank you, Jason. We've covered a lot of information, I feel like. I've received a couple questions, so we're gonna go ahead and open it up for a Q&A session. To anyone that's viewing, if you have any questions, you can type them in the chat box. I'm just gonna read them off, and we'll have Eric and Jason answer them. So I did get a question that I think would be helpful for reiteration, but what makes you eligible to go to a special needs shelter? And are these qualifications like universal for each county, or are they specific to each county? Is every county different?
Most counties use the same matrix. It's what we call the Miami-Dade matrix. Again, when you register for your special needs registry, it'll tell you if you're eligible. The most basic answer is, do you require oxygen? If you require either portable oxygen or oxygen concentrator, you're eligible pretty much automatically. The other one is, do you require electricity for a life-saving device? What we've done in the past is we've been a little bit more lenient. We've said, oh, hey, you have an electric wheelchair. We've pretty much allowed you into special needs. And that's a lot of that's going to have to be reevaluated this year for some of the people that in the past we've kind of allowed in the special needs without they've been kind of borderline of functional needs. However, due to the space requirements of COVID and some of the distancing and issues that we've faced with planning for this, we've kind of had to say, if you don't meet the true guidance of special needs, then we're going to have to generally put you in a functional needs shelter, which is still a great shelter, and it's still going to provide you with a life-saving location. However, it's not going to be an actual true special needs shelter. So, and again, the registry will actually do that for you.
Okay. And once you register, are you automatically in it? Are you automatically on the registry, or is there like a process that you have to be approved and hear back?
No, once you enroll for the registry, you are on the registry. Now we ask you that you re-enroll every year. You don't have to set up a new account. You don't have to go through and delete your old one. We just ask that you come in once a year and update your account. Easiest thing to do is think about it and just do about it at the beginning of hurricane season. Like, oh, hurricane season, it's time for me to re-enroll in special needs. We'll also send out periodic notices that say, hey, here's some I know emergency management in the past has always sent out paper versions of it with self-addressed stamped envelope. So people could fill it out by hand, fold it up, put it back in the envelope, and mail it back. I can generally tell because anytime somebody updates their information, I get an email. So it's there's been some days where emergency management does batch inputs, and I'll get about 90 emails.
Wow.
So I actually look forward to that because it tells me that 90 people just updated their information.
Mm-hmm.
So.
Okay, thank you. I have a question. Where do you go if you cannot wear a mask? Are you in a separate area in a regular shelter, or do you go to the exposure shelter?
No, if you don't meet any of the categories for exposure, we're definitely not sending you to an exposure shelter. If you've done everything we're asking you to do, social distancing, isolation, wear your mask. However, if you're unable to wear a mask, we're definitely going to put you in what we're calling not a quarantine area. We don't really like the connotations come with quarantine. However, we will put you in an isolation area. So that we're not actually exposing you to everything around you. It's basically for your health, not really everybody else around you. It's pretty much for yours. We will provide masks if you don't have one. So if it's a simple thing of, hey, I left my mask at home, that's quite all right. We have additional masks. If your mask becomes soiled and you need another one, we can provide those. Right now, we've given out probably in the neighborhood of about 20,000 masks to the community, and those are all cloth reusable masks. And if you need any, my number's on there. You can just call me, and we'll provide you with masks.
Good to know. I had a question. Will the special needs shelters have accommodations for if you have like special dietary restrictions? I mean, will they have meet these restrictions?
Of course, we actually have a dietitian that works for the health department. We have nutritionists and dietitians that work for the health department. Again, any type of dietary restrictions you have, we work with the schools to try to accommodate. We can't meet everybody's accommodations. We don't accommodate for really, the schools don't really cook halal or kosher food. However, if you do require special food and you want something that's generally not provided for, we encourage you to bring it. You can bring your own food to the shelter. We encourage you to bring snacks. Any kind of bedding, anything like that. I believe Eric actually had the list of everything you should bring to the shelter from Florida Division of Emergency Management. We fully support that. Last year we had a very nice vegan couple, and they had vegan requirements. We tried to accommodate that as much as possible. I mean, but again, one of the things that you'll hear a lot of the planners say is that the shelters are a shelter of last resort. If you have friends in another area, we'll always encourage you to stay with friends or family or people you feel comfortable with. When you come to the shelter, you may not like the person sitting next to you or the person sitting on the other side. It may be too cool, it may be too warm. It's just a general shelter. So what we try to do is shelters are actually meant for to keep you alive. So we have to kind of remember that too.
Thank you. I'm getting a few more questions in here. This might be a very specific question, but and if you can't answer, that's okay. But how many shelters will open, and does each one have an exposure shelter that's next to it?
In I can only comment on Nassau County. Again, we have we encourage you to reach out to your county emergency management office. However, Nassau County, we don't have a set number of shelters that we open. We open based on the incident. What we'll always do is we'll open from west to east because we have on the eastern side we have the Atlantic Ocean. So we don't want to open a shelter next to the ocean where we're going to get a storm surge potentially. So what we'll always do is we'll open inland. Our exposure shelter is that's a Nassau specific plan. So we will have a Nassau specific plan. Our special needs shelter is generally has a general population shelter within a half mile. That's just the way that we as a county have done it. In the past, it's we've opened all the shelters, and I think there's 14 of them. However, for some incidents, we've only opened 4 or 5. It's really depending on load. With Hurricane Irma, where it was going to hit the East Coast, then it went to the West Coast, then it went back to the East Coast, and then kind of settled about midways through the state. We definitely had a larger influx of travelers that were trying to escape from East Coast to West Coast and back to East Coast. So we did actually have to open up a lot more shelters to deal with that. So we're really adaptive to the ever-changing situation. So I would love to give you a numeric answer and quantify that. However, it's basically a situation by situation answer.
And I think an easy one is many communities have planned shelters as part of their plans that are designated. I mean, more than you typically see open, so that there is the ability to open additional shelters if there is a need. Typically what you'll see is the primary shelters that they would activate with most incidents activated first, and then they have the ability to grow into additional shelters as the demand or as the incident dictates. So while you maybe have seen 3 or 4 or 5 shelters in a given county open one year, you may see some additional shelters open this year just due to the social distancing requirements. But with that being said, the demand of the people and the influx of people showing up at shelters will help to drive or will drive additional shelters opening. And I think really the guidance you're hearing this year is, again, shelters are a last resort. We really hope that you have a plan in place to go tens of miles to families and friends versus hundreds of miles or choosing not to leave the evacuation zone. That just really is not, choosing not to evacuate an evacuate zone if you're asked to leave is really just not a good decision at any level. So we hope that, again, you make your plans first. There will be additional shelter capacity if needed, but the evacuation and the event will dictate that.
And right now, for Nassau County, we have about 125% of our population. So we actually have what we can support every member of our population plus a little bit. So that's, however, I'm not expecting everybody in the county to go to a shelter. There's always going to be people that stay home, people that I've been through this before, I'm not evacuating, that's fine. We encourage you to build a plan, build your house resilient. Do you have a backup generator? Do you have stored oxygen? Do you have a solid plan? If you under no circumstances wanted to go to a shelter, reach out and call me. Ask me what I can do to help you. It's really a situation by situation thing. If Eric wanted to come to my shelter, I have a place for him in a general population shelter. I actually could probably put him to work in my special needs shelter, however, anytime. So it's really we want people to know that we're there as a safety net. If you're going to stay with your friend, but your friend's on vacation or out of the country and you can't stay with them, and you had a very good working plan and all of a sudden your plan doesn't work, we are there. We will make sure that you have a place to go where you are safe. That is the whole thing with sheltering. It shouldn't be your first plan, but it's there just in case you need us. It's like an insurance program for your car.
Awesome. And I think that kind of answers another question that we had. She said, we're concerned as many people say they have taken precautions, but they really have not. We plan on staying home as we have pets and we've been on lockdown for 4 months. Husband needs electricity. Do we still need to register if we have a generator and a few solar panels?
That's a great situation. I love the situations and I love the what if game. So let's say you have a generator, you have fuel for your generator. It's a whole house generator. You have oxygen concentrators in your house, and you're pretty much prepared the best you can be for a storm. Let's say a tree on your neighbor's property, not even on your property, but your neighbor's property falls down and hits your solar panels and damages your house. Your house becomes unsustainable. You can't stay there. Again, you can call us as long as it's not at the height of the storm. We'll do the best to accommodate you. Hurricane Irma, I had a guy show up in the height of the storm, and you know what? We're not going to let you sit in the parking lot. We actually brought him in the shelter and took care of him. That's what we're there for.
And the important part about being
Most of
on the
people-
registry is that it doesn't mean you have to go to a shelter. It just means that you're registered. They can make contact with you and start asking questions, and you've been identified as a potential person with vulnerabilities. So you can still implement your plan. It doesn't stop that. It just highlights that you are a potential person that may need these services, and as such, we have direct contact with you.
Yeah. So I guess I can go back. So what's going to end up happening is we'll call a storm H, right? So H minus about 3 to 4 days. We're going to pull down the special needs registry. We'll actually pull a physical copy of it. And what we'll do is we'll call everybody that's registered. Now, if I call you and say, hey, Mr. Smith, what's your plan for the hurricane? You know what? I'm going out of town. I'm going to go stay with family. That's great. Call us if you need us. Here's a number you can call. Now, say I call Mr. Williams, and Mr. Williams says, you know what? I had a plan. My plan fell through. They're actually doing renovations to my house, and I don't think it's safe to stay. That's great. Okay. Do you need transportation? You know, what are your actual things? And again, we have assets to where we can deploy assets as needed. It's really we're here to help people. We're not going to take you to a special needs shelter and never bring you home. That's not our goal. Our goal is to just make sure that you have a safe way to ride out the storm. So, and again, you can register. It doesn't hurt, even if you're not. If you think today, I'm on the borderline of, you know, sometimes I need help, sometimes I don't. Register for special needs. We'll call you and assess you from there, and then we can honestly give you which shelter to go to that would be central to your geographic location, because we don't want to move you as far away from your house as possible. We want you to be pretty local. So.
That's a good answer. It sounds kind of like the special needs registry is something, if you have any doubt in your mind that you might need it, sign up so that you're there, and the day may come and you may not even have to utilize it, but just as a very last resort to keep you and your loved ones safe. It's definitely an option there. I have a question on clarification that registering, does it automatically give you a spot in a special needs shelter? Is there space for you?
Yeah, so when we do the call down, that's one of the things we'll ask you, are you electrically or oxygen dependent? So again, what we'll do is we'll triage you. And that's basically, just because you register for special needs, there's no actual guarantee that you'll be brought into a special needs shelter. Like I said, this year with COVID, we've increased the social distancing. So we've really limited the amount of family members and some of the ancillary people. In the past, we've allowed people that were kind of, oh, hey, I'm on a nebulizer treatment. Okay, we can take care of that. Some of our higher acuity patients, we're going to probably try to evacuate to a hospital just due to their special requirements. Anybody on a vent, we're going to always try to give them a hospital space. But just because you're on the registry, we'll triage you once we start our call down. And that triage will basically send you to whichever shelter is applicable to you, really, at the time.
Okay, and if you're on the special needs registry, do you all provide transportation? If there's a hurricane and you're in the storm and you need to go to a shelter, will there be transportation available, or do you have to organize it yourself?
We do. If you would like to organize transportation for yourself, we encourage that. However, we also offer transportation through the school board, and along with in Nassau County, we offer it to the school board and the Nassau County Council of Aging, which I believe is one of your partners. So it's a very good system that's worked. It's paid very good dividends in the past. We've been able to transport people in conjunction with the fire department, where we actually had one group because of localized flooding, because we had a nor'easter prior to the storm. We actually sent the fire department on a gator to their house to get them, and then transport the person to the bus to evacuate. So we're the masters of unusual circumstances and how to accommodate that.
Thank you. And I think that you know, you do speak for Nassau County, but if anyone in a surrounding county is not sure, when you're creating your hurricane evacuation and shelter plan, call your county emergency operations center and ask them, you know, do you provide transportation, and can you tell me exactly what I need to do? Should something happen, how can I make sure that I get that transportation? If there's any doubt in your mind, just call the County Emergency Operations Center, and I'll provide you guys with that information. It's on the ElderSource website. They have a whole page for 7 counties here locally, and if your county is not on there, let me know and I will figure out the information and send it to you. But just keep that number on hand. In case something happens, if you have any questions, you can always call your emergency operations center. They're specifically in your county. So we have a few more minutes. I've got
And again,
questions.
I'm a state employee. There's basically a person assigned to my role in every county. You can reach out to your Florida Department of Health in your county and just ask for emergency preparedness, and tell them you have a special needs shelter question, and they'll be able to answer it specific to your county.
Perfect. I have a lot of questions on shelters. I think we're really utilizing.
There's a lot of concern around that this year. I mean, justifiably, you know, what is the plan?
Right, right. So if somebody has more than one caregiver and is in a special needs shelter, can the caregivers take turns being with the vulnerable individual to meet the only one caregiver requirement? Or is the caregiver that goes in with them the one that stays until the end?
No. With the shelter, we're not going to limit the amount of people that come and go. We will, if you're just coming in to visit with somebody, we may limit that. However, when we actually send your caregiver to the general population shelter, if they want to rotate out, that's not a problem. We actually encourage that so that you don't have caregiver burning. However, you will have to pass the same screening to enter the shelter as everybody else. We will ask you the same exposure questions. And we will ask you that once you get to the general population shelter, if you are a COVID or if you are a special needs shelter caregiver, we'll have a different area set up for you at that shelter. So it won't be in with the general population. And that'll limit the amount of interaction you have with outside people. Try to lower our infection control rate or infection control exposure.
And I remember seeing somewhere that the amount of care that you receive in a special needs shelter is kind of, it's an accommodation to keep you safe, but it's not necessarily a one-on-one care, keep you to your exact same regimen as before. So a caregiver is highly recommended. And I believe in some counties it is required that you have a caregiver with you when you go to a special needs shelter. And maybe that's changed. I know you only work with Nassau, Jason, but that is another thing that will probably be on the page when you fill out the special needs registry. But if you're unsure, again, call your county emergency operations center and say, hey, do I have to have a caregiver? If I don't have one, can I still come? You know, any kind of question like that, you call and ask. And
I honestly don't know of any counties that require a caregiver because a lot of people are special needs that live alone. And the reason that they're in your shelter is because they do not have an alternate plan. However, I mean, we will take you. I mean, we do not want you out in the storm in the parking lot in your car. By all means, we'll take you without a caregiver. We'll take you with a caregiver. We encourage a caregiver because you're not going to receive the same care at a shelter that you will at home. You know, we'll provide you with a blanket and a cot. That's pretty much what we provide you. We encourage you to bring any medical equipment that you need to survive. I mean, don't bring your TV, don't bring anything like that. However, we encourage you to bring your oxygen concentrator. If for some reason your oxygen concentrator has a problem with it or you forget it at home, that's quite all right. We have some. We will provide, if your oxygen concentrator is working and then all of a sudden stops working, don't fear, we have one of those. We have additional concentrators on hand along with bottled oxygen. We ask you to bring your own. However, you know, plans change and things fail. and life happens. So we try to plan for every eventuality and try to mitigate the amount of risk that people are having.
Okay, I have one last question. It is, how do you accommodate residents with cognitive difficulties?
In special needs and general population, we actually have people that are trained in that. Most of our staff have a lot of the dementia training. They've dealt with the people with dementia, sundowners. So we've actually figured out how to do that.
I actually didn't know that.
Yeah, a lot of our staff are trained in that. We have Healthy Start, we have WIC, we have programs for the young, we have programs for the elderly. So we have dementia training, and we have a lot of our people that are social workers. So we have, my staff is going to be completely empathetic to pretty much any situation that you bring. We're going to accommodate you, and we're going to take care of you. We're not going to turn you out and have you just in a bad situation. We're going to make sure you get to where you're going and that you survive the storm. We're not going to close the shelter and send you home to a destroyed house. We're going to try to accommodate you. If we have to negotiate with the Red Cross to put you into a temporary facility, we can do that. I think my director is actually on here, and she's one of the people that's kind of led our county in accommodations for the elderly, and along with working with different agencies to try to find somebody the best fit. Special needs shelter may not be the best fit for somebody on a ventilator. However, we're going to work with area hospitals, and we may transport you to Baker County, because their special needs shelter is in a hospital. However, we're going to make sure that we're going to find the best care for you. Again, we encourage you to make your own plan. However, if for some reason your plan doesn't work out, or you can't make a plan, we're there to help you.
Awesome. Well, thank you. Eric, did you have anything else you wanted to share before we
No,
close out?
I think what it comes down to is you've heard Jason and I say over and over, we're providing general guidance and expectations. Again, please go to your county emergency management website, register for their notification system, and start being proactive now. You have the tools and the resources available to you to build the best plan for yourself. Don't wait to the last minute to build your plan. So I encourage you to have plan A, plan B. Again, Jason's talked about, shelters as a last resort, and we've hammered that home a couple times, but identify that friend, family, close relative that you can shelter with to ride out the storm for health and safety is really what it comes down to. So be proactive, start now. You're in charge of your own destiny, and then adhere to your local county emergency management guidance if the storm truly does come.
Mm-hmm. You definitely cannot be too prepared.
No, and especially this year, I think, again, you don't want to be having to answer questions and dealing with COVID consternation leading into an evacuation. Start answering some of those questions now and work with your team to build a plan that will be successful for all of you.
Mm-hmm.
And you'll hear us a lot say that, we plan for the worst and then we hope for the best, and we kind of meet in the middle. So as long as we have a plan for the worst case scenario, when the best case scenario happens, we're prepared for that too.
Great. Well, thank you. So we've kind of gone past our time a little bit, but I want to thank both of you for spending your Saturday morning with us. I know both of you kind of had to make a little bit of an accommodation to be able to join us. So I really, really appreciate it. I'm sure our viewers appreciate it. It's been a lot of very helpful and eye-opening information. So just as we start to close out the presentation, I'd like to take a minute just to get some feedback from our viewers. If you're joining us through the Zoom app or on your desktop, I'm getting ready to send a poll, and that poll is very quick. It's, I think I've got 4 questions on there. So if you could fill that out, that helps us plan for all of the upcoming sessions so that we can know if we need to make it a little bit longer, a little bit shorter. It helps us plan. And everyone that fills out the poll will be entered to win a $50 Amazon gift card. So we'll choose the name randomly after the session, and we'll contact you through the email address that you used to register. So just a couple minutes to fill that out. And while you do that, I do have another resource. The Department of Elder Affairs sends out every year a disaster resource guide. So they published a special edition for the summer. I'm going to include a PDF copy in the follow-up email that I send out because it's got a lot of information in it. I mean, it's pretty much like a newspaper. That's got all of your checklists, how to prepare, pretty much everything that we covered today. So if you would like a printed version, if you'd like to have it on hand, if you email info@myeldersource.org, include your mailing address and that you would like a copy of that 2020 hurricane guide, and we can mail that out to you so that you have a hard copy on hand. Last thing is we will be doing another virtual caregiver workshop next month, Saturday, August 15th, same time, 10 a.m. to 11 a.m. I'm going to announce the topic through email, so make sure that you're subscribed to the Caring Together newsletter email list. You can sign up through our website, caregivercoalition.org, and we'll send information on the August session out as soon as the details unfold. You can also like us on Facebook. That's there at the bottom, the Caregiver Coalition, NEFL. If you have any other questions, you can reach out to me directly, or you can visit our website, caregivercoalition.org, and fill out the questions or comments form at the bottom of the page. All of those messages get sent straight to my email inbox so I can respond to you as soon as I get the opportunity. And that pretty much closes us out. I mean, a final thank you to Eric Anderson from the Northeast Florida Regional Council and Jason Miller from the Florida Department of Health in Nassau County. And another thank you to everybody that participated. Hopefully we will see you next month, and I hope that you all enjoy the rest of your Saturday. Thank you.
Having us.
Thanks.